I'm Dr. Craig Joseph.
And I'm Dr. Jerome Pagani, and this is Doc Talk.
We've spoken about the big squeeze a lot lately, and that's because it's a big deal for health systems. Most are trying to work through some incredibly complex problems at a time when their resources, both human and financial, are at an all-time low. On the people side, healthcare is experiencing labor pains around the world. This has been caused by a combination of burnout, the Great Resignation, and an educational pipeline that isn't turning out enough skilled people to meet demand. This has led to a greater reliance on contract labor. Even before the pandemic, the use of non-salaried personnel has been increasing, rising precipitously during peak COVID-19 and continuing to climb since.
Healthcare's labor pains are a global phenomenon. The World Health Organization estimates that there will be a shortage of 15 million health professionals by 2030. In the US, a reported 1/3 of nurses plan to leave their current role by the end of 2022. It's estimated that by 2025, the nursing and physician labor force could fall short of demand by 10 to 20 and 6 to 10% respectively. In the UK, NHS labor force costs rose by more than 12% from 2019 to 2020. And the gap between demand for nurses and GPs in the UK is expected to account for about 7% of the total workforce by 2025, or around 180,000 full-time employees. US healthcare labor expenses are projected to increase by $86 billion in 2022. The US clinical labor shortage could create $170 billion in incremental costs by 2027, primarily from wage growth as resources become scarce.
Perennial staffing shortages create problems on a number of fronts. While always bad for morale, they can significantly impact the day-to-day well-being of healthcare workers and exacerbate burnout. This in turn contributes to higher rates of turnover, increasing the reliance on contract labor, which increases labor costs. Supply and demand also has an inflationary effect on wages, whether due to low absolute numbers or a dearth of professionals within a particular locality. Staffing issues also affect a system's ability to operate at full capacity and thereby generate revenue. It can also impact quality and safety, which poses risk to the patients and the organization itself. Health systems are also competing with new entrants offering patient experiences similar to what consumers are getting in other parts of their life. A staffing shortage means that there is less opportunity to offer the personal touch. This creates a risk for referral leakage to those newer to healthcare with a strong consumer focus.
As we've discussed elsewhere, efficiency and not wholesale operational expenditure reduction is the key to freezing the squeeze. Health systems are continuing to look for ways to deliver care more efficiently and frequently more effectively. Labor issues can be dealt with on a number of fronts. On the process side, while streamlining the optimization of back office operations and finance are low-hanging fruit, much can still be done on the clinical side. This includes identifying unwarranted care variation that can affect cost, quality, and safety, as well as leveraging team-based care to ensure that all clinicians work at the top of their licenses. Automation is an effective tool for patient engagement, scheduling for both patients and clinical staff, and for supporting the clinical workflow. This can take the form of process automation, conversational algorithms capable of high-fidelity natural language processing, or other digital tools that extend the health system's front doors to wherever the patient or clinical staff may be. It's essential that patients have the consumer experience that new healthcare entrants are offering. For incumbents, now is the time to rethink how patients engage with your organization and how your clinicians and other staff work with one another to keep the mission thriving. Try to relax while I test your Nutella reflex.
Are you pretending to be a physician again?
No.
But you've already taken my copay.
Yeah.